Okay, next up we have PainChek, ASX code PCK, and they have a market cap of around 66 million. PainChek is an Australian-based company that develops pain assessment technologies. We welcome back PainChek CEO and MD, Philip Daffas. Philip, welcome back, my friend.
Thank you, Paul, and thank you to everyone who's tuned in today to listen to the talk. I'd like to start by saying pain assessment is very difficult, but it's also especially difficult for those people who cannot verbalize or cannot communicate their pain. Next slide, please. This includes people living with dementia and other cognitive impairments, and of course, pre-verbal children who have not actually built those communication skills as yet. In these cases, pain can be misdiagnosed, it can be undertreated, and in some cases can be misdiagnosed and therefore mistreated. So our goal and our vision is to give a voice to those people who cannot reliably verbalize their pain and therefore make sure they do receive the correct treatment and the correct care at those times. At PainChek, we've developed two technologies, an adult version and an infant version. The adult version is now on the market for a few years now and it's done extremely well, and the infant version is about to be launched. Next slide, please. So the PainChek infant adult technologies is what I'll focus on right now, is the first to market. It's actually a world first in the sense that it's a digital pain assessment technology. It's a medical device that comes in the form of an app, and it works on either iOS or Android devices, and it's regulatory cleared in multiple markets. It's really a two-step process to assess pain. It uses first the artificial intelligence that's built into the system to scan the face and assess the face to pick up the 9 microfacial features of pain. And then we use smart automation to guide a carer through the other 5 steps of the pain assessment, including looking at movement and behaviors and body assessments, to come up with a total pain score. That pain score is then documented, is stored, there's graphics and there's information that shows the management of pain, and it's all stored via the cloud in our back end, and we provide data back to our clients in terms of how they're managing pain at different levels across the organization, and that can be used for accreditation and audit purposes. So in many ways, PainChek is a combination of artificial intelligence, smart automation, and human intelligence to give a good pain score, a better pain score, and a better pain management experience. Next slide, please. So these are significant markets. There's 57 million people in the world live with dementia, growing to 150 million by 2050. And people with dementia live really between three or four areas. They live between home, an aged care facility, and hospitals. And in hospitals, about 30% or more than 30% of beds are occupied by people who live with dementia. The other area we'll talk about a little bit today is retirement villages. Retirement villages are now where we're seeing PainChek being used next phase, because that's where people are entering retirement at the age of 80, and therefore the need for pain assessment in those areas is also increasing. On the other extreme, there's 400 million pre-verbal children in the world at any one time, and therefore a very big market. It actually dwarfs the adult market and a very large market for us. Next slide, please. So in terms of valuing these markets, or putting a size on them, we know that there's about 6 million beds in aged care around the world, and at our pricing, around $50 per bed per annum, it's around a 300 million market, annual market ARR opportunity. We believe home care, retirement villages, all those areas will be 10 times that size going forward, as more and more people want to live at home in an aging population and to be cared for in those environments. The infant markets, our first stab at that is an infant product from 0 to 1 years of age. And that's 150 million children born to first-time parents each year. And we've worked out that 1% penetration of the pre-verbal children's market will give us the same value potentially as the whole of the aged care market. So that's a significant market. And finally, hospital markets, where we're focusing for the future as well. Right now, actually working with the company InterSystems and some key clients in the UK. Next slide, please. So progress to date, and these are really the June results. We'll be publishing the latest quarter results end of this month. But as you can see here, we've now got more than 1,000 aged care facilities under contracts annual license contracts across 3 continents. That's a significant progress. If you look at the bottom right, there's 50,000 beds in Australia across 700 aged care facilities. In the UK, as of June, we had close to 20,000 contracted beds across 300 aged care facilities. And most recently, we just got 2 new agreements. Our first clients in Canada, which provides a really good base for us to enter the US market, North American market next year. We're also targeting to go into Europe next year, mainland Europe, and also we're progressing our work with Japan, which is the 2nd largest dementia market in the world. Next slide, please. Bit of a deep dive in Australia. It's very comfortably we can say now we're aged care's most popular clinical digital tool. We've got 25% penetrated that market. It's growing daily. As I said before, we are looking to expand into other sectors. If you look at those clients at the bottom there, those 9 large clients in aged care cover more than 20,000 beds. They're annual or biannual contracts we have with them. And they're also working with us to go into home care and work with us to go into retirement living. As I said before, the average entry age is now 80 years of age. So aged care is the initial market, but those partners in aged care are taking us into home care and are taking us into retirement villages as well. Next slide, please. We have a team in the UK who've done a really good job over the last year. They've grown the market significantly. We have large aged care facility clients. We've got small ones, medium-sized ones. And typically what happens, as is in the case of HC1 on the bottom left there, is we do a 2 or 3 month pilot, and then they look to roll out across all their beds. Exemplar is an example of how that works. They're now 1,800 beds. We're right in the process now with HC1. HC1 have actually got 20,000 beds across the whole estate. We're doing a pilot for 3 months across 3 of their sites, and we're looking to expand across them. The other things we're getting is funding from local councils, such as the Enfield Council, and we're also getting funding from Scotland's Care Inspectorate, who've done a really interesting trial using PainChek. We're getting some significant results, and it's now expanding. Next slide, please. If you look at the results of this is what's driving the take-up of PainChek. It's not the technology. The technology is accepted now. It works. What's really happening now is that they're seeing improved outcomes for those people who can't verbalise reliably. So taking the Scottish work, they saw reduction in falls across their residents, 75% reduction in falls over 3 months, which of course falls, if you're in pain, you're more likely to have a fall. So rather than trying to watch people falling and setting up cameras in the aged care facility, you're much better off managing their pain, treating their pain better and reducing it. The other thing they saw a reduction on is reduced stress and distress from their residents. If you're in pain and you can't communicate, you can become very distressed. That has to be reported. We're helping to reduce those. And finally, of course, we're making sure that more appropriate pain medication and reduction in the rates and the volume of pain medication provided. We're now in the phase 2 of this project. It's going across more groups. They're looking at quality of life. They're looking at long-term sustainability and using it across all of social care in Scotland. So this sort of data will actually help us expand the business significantly, not just in the UK, but internationally. And of course, we think we do a great job in Scotland. Next slide, please. Our latest client is in Canada. This was a press release by St. Michael's. So this is they're our first Canadian client. Again, it was a 3-month pilot. They loved it. They loved it. They've now signed a 3-year agreement. We've also got another client in Canada's Sherwood Care, who just started as well. Again, with a 3-year agreement with PainChek. And you can see the comments from the team there. Like we've been saying for years, this is the next evolution in pain assessment. It's making a significant difference as to how they're managing pain, and it's changing the results of their patients and their residents' ways of life. So, better off hearing it from the customer than hearing it from us. The customers love the product, but more importantly, they love the outcomes that it delivers, or it helps deliver. Next slide, please. Partners are important for us. This is a great representation of all the integration partners we have, technology integration partners. There's more than 30 now we've integrated with. And these partners do 2 things for us. One is they ensure that when our technology, our pain assessment technology is conducted and the pain assessment is documented, it gets transferred immediately into their care management and their medication management systems, which means they can actually treat patients in real time on real data. Second thing that they do is they provide us access to about 1.5 million aged care beds, because that's what they cover in these markets. And now some of them actually started to look at reselling for us. So these are our partners, not just for integration and documentation, but also for reselling potentially. Next slide, please. In the US, as you know, big market for us. We now have some Canadian sales. We have commenced the clinical study. It's up on the FDA website. We've commenced the clinical study. We've started to recruit in Iowa and in New York, first patients. It's a small study, 100-patient study. We should get the work completed before the end of this year, submitted to the FDA, and therefore be ready to actually get the regulatory clearance from the FDA in either the end of first quarter or early second quarter next year. In the meantime, we've already got partnerships with PainChek Care, with Ethos Labs and Systems, who will give us both sales and marketing, integration, and hospital access into the US market. So we're well positioned to go into the US, and I am now looking to recruit somebody to be the head of business development in the United States for PainChek to manage that complexity. Next slide, please. Finally, in terms of the infant product, as you know, we do have the facial assessment technology complete. We've been doing some testing with consumers, some market testing, some great feedback. We're going to do the second step of that market research before we go into the market. We've got support for Melbourne Kids, and we've now got a vocalization feature. Next slide, please. This is what we wanted to do with the kids, is basically the goal is to make infant pain visible and make it audible. So we have a technology that can identify a cry of pain or no pain, which could be going to baby monitor or into our app. That will guide a parent to actually look to address the pain and intervene. And after that, the facial assessment part of the PainChek technology can actually document the pain level and then allow pain to be cared for. That's the sort of focus we have, and therefore our goal is make it visible and make it audible for parents. Next slide, please. I think I'll hold it there. I can talk about these catalysts during the questions and answers, and back over to you, Paul.
Philip, thank you. Clearly a lot of good things going on at PainChek at the moment, and your share price would suggest the same, Philip. But let's kick off. Last financial year, revenues obviously grew strongly. What sort of revenue growth can people expect for the next financial year, and what do you see as the key drivers of that growth?
Look, we see continued growth, obviously, in our core markets, Australia, as listed here, Australia, New Zealand, UK, Canada, they're all existing markets, and we see significant growth in those. We have got regulatory clearance in Europe, so I'm actually over in Europe next month, meeting some people in mainland Europe, one of the big markets. We're looking to enter France and Germany, and so that's continued growth. And of course, the US, we should have FDA clearance by second quarter latest next year, and we've already got the partners in place there. So this, what I would say, is accelerated growth through those markets and through those partnerships we have in place. I'm not going to give a number, but I would say we are looking to grow significantly as we've done over the past year.
Yeah. And who are the key competitors to PainChek?
That's the beauty. There's none.
Yeah.
The only competitors are the old paper-based manual systems, which are being discarded now. And more important than that, every single aged care facility, not in hospitals, they're all going digital. So they need a digital technology that can assess pain at the point of care and document it in real time. We're the only product that does that, and we're the only product that does it using objective measures, which is the AI. And we also incorporate the observations by the carer, which is really important. So we have been accepted because we've transformed the way they manage pain, but it's based upon the historical methods of recognized pain assessment. Okay, and there's a couple of questions on this topic. What's the timeline for the US FDA approval? Any update on that? Just exactly as I said before, we've started recruitment. We've got the first. We're recruiting patients now in Iowa and New York. It's a 100-patient study. There's different ethnicities required across that, 20 of each group. We've got those all identified. We should complete the study this calendar year, submit it before the end of this calendar year, and then the FDA is 120 to 130 30-day on average response. And so that means that takes us to the second quarter next year, and we've got the partners in place to actually rapidly enter the market. And I would add, we are looking to put in a business development person in there beforehand, so we can actually rapidly maximize the opportunity.
Okay, and there's a question here. Could you explain the difference between contracted beds and live beds? And also, is the return to PainChek for the home care user the same as in care home?
Oh, first question is contracted beds against?
Contracted beds and live beds. Can you explain the difference?
Yeah, so when we talk about ARR, that's our contracted bed. That's the number of beds we have under contract. So I think that was 70,000 at the end of last quarter. Now, live beds are the beds that are actually been implemented. So we actually bill on implementation. So there's a gap between one to the other. So one's about the ARR, the value of the licenses, and the second one is the actual revenue we recognize, which is the live beds. There was a gap in the UK because we signed up a lot of clients in a very short period of time. They're being rolled out now, being implemented, and so that gap is narrowing all the time.
Gotcha. And you mentioned that Japan's a market that you're perhaps focusing on, and someone just said, any idea on the sort of time frame before you get into Japan?
Japan's a complex one. Japan takes a time. We're talking to the regulators now about what classification we fit in terms of the PDMA, that's the regulatory group there. I would say Japan is probably going to be a 2025 entry project, while the US and North America for us is the 2024 focus.
Got you. Now, a question here, outside of aged care, what are the key new sector markets that perhaps you may target?
Yeah, I talked about this a bit earlier. We see the way care is moving with we're an aging population, and I'm one of those, baby boomer. People want to stay at home. So all those services, and governments have changed their policies. If you look at Australia, if you need aged care type care, you can have that now in the home. It's a person's choice. The money follows the person now. So homes are being set up so we can live at home as long as we possibly can and have the services such as PainChek. We've got a number of home care partners we're talking to. Retirement villages, we're working with two of our big clients to say, how do we bring PainChek into retirement villages so people, when they go in there, they can stay there right through for the rest of their lives, rather than picked up at some stage and moved across to an aged care facility. You need to manage pain in those situations. You need to have that for the whole of life. So for us, aged care was a great testing ground to build the product, but the real markets, the big markets, are home care, retirement living, and especially for the infant product. The infant product could actually dwarf all of these because that's got an enormous opportunity as mums and dads at home, rather than having to, they don't want to go to hospitals now. Hospitals are flooded with people. If you can treat basic pain management at home and do it effectively, as you do with temperature, as you do with blood pressure and everything else, it's a home product. And that's why direct to consumer for the infant is actually also really, really important for us.
Philip, it's been an absolute pleasure having you on today. Clearly, it's a lot of momentum at PainChek. We'll be keeping a very close eye on the story. You have a great weekend.
Thank you very much, Paul, and thank you to everyone for listening.
And there's a few other questions there. If you do have the time, Philip, we'd much appreciate if you could answer those offline.
Happy to do so.
Fantastic.